Amyotrophic lateral sclerosis, also known as ALS. ALS is a neurological disorder in which the motor neurons are impacted, meaning that the nerve cells controlling our muscles that help us to move and breathe are being affected. So what occurs is that these motor neurons no longer transmit nerve impulses to the muscles, which causes them to weaken. This can also be referred to as muscle atrophy. This impacts movement in the body that is voluntary, including chewing, walking, and talking. This also impacts speaking and swallowing, which occurs through the gradual weakening of the bulbar muscles, which are the muscles in the mouth and throat. So with that, the diagnosis of ALS is conducted through a series of tests such as an MRI, an electromyography, a needle exam, and also a nerve conduction study. So the purpose of these tests are to test the nerve reflexes and the response of the muscles, but they are also used to rule out other potential diseases. So by doing these tests, you're also figuring out what other diseases you are not at risk for, but we're also testing the nerve reflexes and the response of the muscles to see if you have ALS. Now, with that, the worst thing about ALS, I feel, is that it is a progressive disorder, meaning that there are early on symptoms, but then there's also symptoms that differ through the progression of ALS. So early symptoms can include muscle weakness, muscle stiffness, difficulty with swallowing or chewing, and many more. With the progression of ALS, there's also further problems with chewing or swallowing, along with difficulty breathing, crying, or laughing that is not intentional. So, in turn, you need to grasp that speech is difficult to understand and produce with the progression of ALS. Now, there are also several risk factors for ALS, one being sex. This is sexual orientation, and it states that men have a somewhat greater chance of getting ALS opposed to women. Now, another one is also age. So this is more common in people that are older, and the age range that I found online was 55 to 75. So it can be possible in people that are younger than in this age bracket, but this is the more common age bracket that there is. So then the last risk factor is also race and ethnicity. And like with other disorders, diseases, there are certain groups that are more likely to have a disorder or disease than another group. So for this, it is more common in people who are white and of not Hispanic origin. Now, as we're coming to the end of the presentation, I wanted to speak a little bit about treatment. So there are a few treatment options which are somewhat beneficial for ALS, and this includes medications. There's medications like Riluzole, Reliviro, Tofersen, and many others. So then alongside with the medication, there are also other options like occupational therapy that can be done. And by doing this therapy, we can also help maintain the function of the muscles due to them being impacted. Lastly, psychological treatment is also very crucial. And so speaking to someone or having a support system is very, very crucial in the treatment of ALS. So obviously when there's something wrong with you, you want someone to be there for you. You want to have somebody to speak to. So alongside with the medication and the occupational therapy, also having some psychological help or just help from a family member is very crucial in the treatment process. With that, the result of ALS is the inability to walk, stand, and breathe. So the inability to breathe can lead to death, which occurs 3 to 5 years after ALS symptoms begin. Now, this is not the case for every single person with ALS. Like with anything else, the result of ALS is different in everybody. So what this means is that not everyone with ALS is prone to death so suddenly. That means that not everybody is going to die after 3 to 5 years of experiencing ALS symptoms. And statistics actually show that 10% of people with ALS can actually live on for another decade. So even though this isn't a great percentage of people, at least there is hope that your life basically isn't going to end so suddenly if you do have ALS. So with the proper treatment and management, you can possibly live on for longer. Now, I just wanted to turn to the image that is displayed above. So as we can see, there is a normal nerve cell on the left. We could see the healthy muscle, the healthy tissue with the nerve cell that's connected to that muscle. Now, on the right side, you could see the death of the nerve cell that is affected by ALS. So this is wasted muscle. It's muscle that isn't functioning properly anymore. And even just the discoloration in the nerve cell and the muscle is just, you could see the effect of ALS. And that is all for today. So I hope you got enough information from my presentation that you further understand ALS. Thank you.